Is that on your paperwork too?
Yep.
Okay.
Yeah. Yep.
Thank you. Thank you for now.
Representative Sampson?
Thank you, Madam Chair. So I want to ask you some questions about herd immunity and speak to that
again,
if we could. Well, I have some specific questions.
If it's about the data, right, within, so
But
they're
this
not
would've-
physicians.
I know.
Okay.
I understand. This is CDC information.
Okay.
So,
Well-
so what I'm asking is that, do you have the percentage of adults, Maine adults that are vaccinated to the CDC schedule? You don't have that, okay.
No.
So I have this study in front of me, the CDC study, that says overall, the prevalence of illness attributed to vaccine preventable diseases is greater among adults than children. Can you speak to that?
Is that a Maine CDC report or a US CDC report?
Well, it's a US CDC report, but I would think it would be pertinent to this.
So I would like to be able to see the document so I could reflect on it, so that I
Okay,
could
well,
respond
I'll
to it.
have to get you the website.
Yeah, that would be where, and I don't know what disease you're referring to, so that would be another component. Herd immunity is for different diseases as well, so I would want to be able to more thoroughly answer your question, so I might just need more time on that.
Thank you.
Thank you.
Thank you. Thank you.
Ms. Warren, would you like to come forward? Senator Pouliot, do you have a question?
I do. Thank you, Madam Chair. Thank you, Ms. Warren, for coming forward. In the public hearing, you had testified about concerns with the bill and related, obviously, to the student population that you serve, which are, adults ranging anywhere from probably 18 to 70. How many of these individuals would be impacted by this legislation?
Thank you.
have to close that.
Pardon? Away. Good morning, Samantha Warren, Director of Government Relations for the University of Maine System. We report annually to the department, and they put together a report that I think the department was referencing. I think the most recent is 17-18 Post-Secondary School Immunization Assessment Report. And I think the department representative was speaking about the 47,000 plus students requiring vaccination in the post-secondary level. To be very clear, that is both public and private institutions, so it is not just the public post-secondary institutions that are affected and required to report. And of course, the University of Maine System comprises, with our 7 institutions, more than half of those 47,000 students. And as the report shows, about 3.8% of students are opting out for religious or philosophical exemptions. A much smaller amount are claiming medical exemption, and then about 4% have incomplete records and so are non-compliant. So the total population that would actually not be compliant under this legislation is closer to 8%. So I think that's what you were just speaking to. And I have the exact numbers for 2 of our campuses that would be most affected by this legislation. And again, the system testified neither for nor against and are very committed to working with the committee and the department to ensuring compliance if this moves forward. But we are worried about this specific population. So at the University of Maine at Augusta, where we serve the largest percentage of kind of non-traditional students, many of them who are not accessing the Augusta or Bangor campuses, but are using our regional centers, say in Holton or Millinocket. There are around 700 students who are claiming philosophical exemptions for the MMR vaccine, related vaccinations. About 20 students who are claiming religious reasons for exemption, so a pretty small amount there. And then about 130 students who are non-compliant. So at that campus, there are about 800 students, or about a quarter of the students who are using existing exemptions or are non-compliant. And then at the University of Southern Maine, the other campus most affected, 433 students are using philosophical exemptions, 15 religious, so again, very small. 221 are non-compliant, and 83 students were born before 1956, and so do not need to be in compliance. So just with those campuses alone, which again are the campuses that are most affected, we have over 1,500 students who are either non-compliant, which does not mean that they do not have the vaccinations, they just maybe do not have the records easily accessible, which is what we most commonly hear. And I provided to the analyst the opt-out paperwork, and it's a very simple form. It essentially yes, that. You have a nice colored copy. It requires, as folks probably saw in the committee, the name, the address, and then the student literally checking a box. I'm opting out because of a religious reason or a philosophical reason, and then there is an opportunity for them to provide some reasoning, but that is not required. They also have to sign that by submitting this form, in the event of an outbreak, they understand that they will be barred from classes immediately, and that is something that we have had to do. I think several years ago at USM, students had to leave campus because of an outbreak. Does that answer your questions? And
Representative Drinkwater.
Thank you, Madam Chair. Did you happen to run the numbers to see what impact this would have on dollars? So do we know how much financial impact that would have?
I did not do that, Representative. I think for us, it's more, certainly I can say that our enrollment folks are very concerned about this, but everyone else on campus is really supportive of this, right? So I think I talked about that when I testified, the kind of how conflicted we are, and it is entirely because of the attainment reasons. You know, we want folks to have access to public post-secondary education. So we did not equate that to dollars. I think that would be something that would be difficult to do. Many of these adult students are not taking a full load of courses, but if you are a part-time degree-seeking student, you are eligible. You must be compliant. The one exception is if you are entirely an online student. And very few of our students are entirely online because many of our online courses do have a kind of a blended approach where you do have to visit a campus center or campus at some point. But that's why our overall enrollment is different than the number of students who are required to be vaccinated. But no, to answer your question, we did not connect this to dollars.
Representative Fecto.
Thank you, Madam Chair. Thank you for coming this morning. Do you have any numbers on how many international students this may affect?
I do not have that. I could certainly get that in the future. The department could speak more to this, but I think many of our international students have previously been enrolled in U.S. high schools, and so I don't see them as being uniquely affected by this in contrast to our non-traditional students. But I could certainly try to get that information for you. I can just say that one of the things, and I shared this with the bill sponsor, one of the things that the university is committed to doing as this moves forward is to survey these students. Again, we know who they are because we need to know who they are in the event of an outbreak, and we will be surveying them if this legislation passes to better understand what their barriers are, so we can work with the department to help them, both departments, Education and Health and Human Services, to help them overcome those barriers.
Thank you.
Representative Sampson.
Thank you, Madam Chair. Thank you, Ms. Warren, for being here. So you're talking about surveys, and I'm thinking, gosh, have you done any kind of preliminary survey to see how this, if students who are currently enrolled are already thinking about not re-enrolling if this passes? I spoke with a professor that said that their students, her students, some of them are thinking about not enrolling right now. So the enrollment is open currently, is that right?
Yes.
I mean, are you?
Always.
But, I mean, it's too soon to tell if it's being impacted yet. But, so can you speak to that?
We have not surveyed students, and I would have, I'm sure there are anecdotes like that, but I have not specifically heard that from individuals. And certainly, you know, there are 2,000 plus bills up for debate this year. I'm careful about, you know, causing too much alarm on our campus communities about legislation, and I know the sponsor has been very sensitive to an implementation timeline that would allow us to work towards full compliance, but I haven't talked to anyone directly.
Representative Anderson?
Thank you for coming.
Good morning.
It's good to have you here. I have a couple questions for you. Do you have any, I probably don't have any data on this, but do you have any anecdotal sense of, since this exemption form is so easy to fill out for philosophical objections, that students are just opting for that because they can't find their records? They're the age they are. They know they got a shot when they were a kid. I mean, I entered school late in the 40s, and the same thing happened to me. I had to find out where my vaccines were, that they just like, can fill this out and that's it. Is there a lot of that happening in your sense, anecdotally, or?
I would say from my conversations with folks in our enrollment departments that yes, the answer to your question is yes. I think especially for our adult students, unlike you know, a traditional age student who is, you know, preparing now to start in the fall and working with their families to get all their paperwork in order, many of our adult students are literally enrolling, you know, the day a class starts or maybe even after the fact, and so in their scramble to get in, I think many are probably, you know, just checking that box because it's the path of least resistance, and we want them to come through the door and get education and the opportunities that create. So I don't think we're making it particularly difficult, and of course we've been reporting this data for many years and it has not attracted attention until now. So I think we will find that when we survey students.
Okay. And one more question. And have you had any conversations or thoughts or ideas that if this bill goes through, how would you approach the goal of getting folks vaccinated to a high percentage?
So when I testified, I suggested on behalf of our campuses some recommendations that even if they didn't make it into the amendment, I would hope that the departments would be willing to work with the post-secondary systems, most notably the university and the community college, because if you look at the data, we are most affected by this. And we would really like to work with the departments to figure out, again, how we address this, and I think surveying students will be helpful to understanding that. I think the Maine CDC has the Maine immunization program that's currently, they could speak to that much more eloquently and informally than I could, but my understanding is that provides low or no-cost vaccinations to those under the age of 18. We would love for them to consider if it is possible without a fiscal burden that's insurmountable to work with us to possibly make those vaccines available at no or low cost to our students. Certainly Medicaid expansion will address some of this population. We have health centers on 6 of our campuses. UMA does not have a health center, but we would love to partner with some of the local hospitals or healthcare providers, as well as the community college, to do vaccination clinics on our campuses and also in the communities where we have large populations of students. Again, using those regional centers. So I think in East Millinocket, for example, we have a regional center that both the community college and the university, as well as other partners in the community, have offices at. So doing a clinic at a place like that to bring the vaccinations as close to the students as possible. So those were some of the things we suggested.
Thank you, that was very helpful.
Senator Pouliot?
Thank you. Ms. Warren, you and I are both on the Maine Spark Coalition, and this group in the past has advocated for us reaching an attainment goal of 60% of our population in the state of Maine having some form of post-secondary degree or credential of value. Is it your opinion that this bill helps or harms our ability to achieve that goal?
That is a loaded question, Senator, which I want to be very careful to answer.
Ms. Warren, you don't have to. That's not for you to have to respond to.
We would welcome support from the departments in helping our students be vaccinated if this moves forward. And I think I see Northern Light Health here in the department, and I think those are all the folks who will be leaning on to help us ensure compliance, because certainly we do have a percentage of students who would not be compliant now, who we would want to keep in the system.
Representative Rudnicki?
Thank you, Madam Chair. You meant, and thank you, Ms. Warren. You mentioned that we have students, you have students now in the community college system that it's a last minute thing. They decide, you know what, I'm going to college, and that's all there is to it, and it's the day classes start. How do you think this bill is going to affect those students? Because you've mentioned that some of those students are the ones that are choosing the exemptions because it's quicker. So how is that going to affect that enrollment based on, and I know it's hard to predict, but do you feel it's going to have an effect, and how are you going to help those students?
So I appreciate the question. I don't speak for the community college. I know my counterpart, Becky Smith, from the community college, who has a lot of public health background, is here and would be happy to answer those questions. But from the university's perspective, I can tell you what we do now, as it may be informative. So if a student of any age shows up at the University of Maine at Augusta to enroll, say, in a May term or a summer course right now, and they did not have their paperwork, their vaccination records, we would still allow them to enroll. We're not going to turn them away, and I don't believe that the changes in this legislation I'm looking at the department for confirmation, would necessitate us doing so. Instead, we would put a flag on their record, basically, and so they could not enroll in the next semester without providing that documentation. So they do have some time, which is why I think you see 4% of the post-secondary population is non-compliant. So someone may be non-compliant for this coming semester, but they would have several months to pull together their required files for the next semester. And I believe we would still be able to practice that policy moving forward, unless, I don't think the department has proposed penalties in any of the rulemaking, so I think we would still allow that grace period. Looking at the department for clarification.
Okay, and we're going to wrap this up.
Thank you.
So, Representative Rudnicki?
So I guess my question is, if they are non-compliant and you have until the next semester and they're enrolled, they are going to class then, with or without an immunization?
Yes, currently.
Okay, but they would be in the future as well if you followed that same practice?
I believe, there's nothing about the bill, I believe, that changes that. The department could certainly do something differently in its rulemaking, and I couldn't speak to that. I'm looking at you for clarification of that. But I don't think anything specifically about the bill does away, it doesn't say, thou shall be expelled or not admitted, the day of, if you can't provide the record. So I think we would still have an ability to give our students a grace period.
Okay, thank you.
Representative Drinkwater.
Thank you, Madam Chair. Could we just have the representative for the community college come forward?
Briefly, we did have a public hearing.
Now, a lot of these questions. You basically told us not to. No. Yeah.
still answer your questions. That's what I'm on board. I'm on board finance. And shall answer. How can you just said you wanted to wrap it up. And for us not to be able to ask these questions, that to me is inappropriate.
Okay, Representative Drinkwater.
Thank you, Madam Chair. You've heard a lot of information and questions from the university. I guess this would be the quickest question to get to wrap this up would be, have you looked at the numbers and see what percentage it would affect you folks also?
Yes, hi, my name is Becky Smith. I'm with the Maine Community College System. I have the same chart that Sam presented earlier, and I don't have an exact number on each campus of people that this would affect. I think everything that Ms. Warren said around the university system also applies to the Maine Community College System, and President Dagler's testimony, which is somewhere in your big red folder, did speak to the fact that we would love to work with the department to assure that if this passes, our students can be vaccinated at enrollment. We do vaccine clinics, and unlike the universities, we don't have health clinics on our campuses, except for one. And so we have had vaccine clinics in the past, and we would be happy to work with the department to assure that we can, and with the university to assure that we can be in compliance with this law if it passes.
Representative Rudnicki?
I don't believe I had something for the community college, other than how the community college would possibly handle the lack of, I guess, the funding requirement, or of how it would affect the funding of the community colleges, because it's going to have a financial impact if I would assume it's going to have a financial impact if students are not coming because of the lack of immunizations, if that's it. And community colleges now are a huge resource, especially in the workforce that we need right now. And if a student isn't, and I guess I'll ask the same type of question, is if a student isn't vaccinated or meet your requirements for whatever reason, whether it's not being vaccinated, or they can't find their records, or whatever reason, are they going to be allowed into the classroom on that very first day, whether or not they are?
I believe that in some cases they are. I looked at the enrollment forms in preparation for helping with the testimony. I think what we do is we also flag and ask them to get their information to us as soon as possible. Whether or not they start classes, I think, may vary from campus to campus, but it is something we're actually looking at now more thoroughly.
Representative McCray.
Thank you, Madam Chair. This is one of the longest times I've kept quiet in quite some time. And it feels strangely good. I guess, I made notes at the hearing, and I came up with 181 testimonies. I took down names, plus or minus, as to whether they were in favor, whatever. I listened intently. Maybe making the notes kept me awake. But I did take it to heart, and I know that this is a very emotionally charged issue. I know that people feel very strongly and sincerely. I would have to say that 95 to 97% of the people took it right, believed it with all their heart. And I guess I'm going to come down on the medical science part of this thing, and it's not to belittle in any way anybody's belief system at all, okay? I support the amendment, and I will be voting in that direction.
Senator Pouliot.
Thanks. Sounds like we're done with question period for now. First, I want to start at 30,000 foot level, which is that a lot of this bill, the genesis of it, is based on data, which we seem to have a lack of continuity consistency with, even from Maine CDC. I appreciate the sponsor's desire to push this out in an effort to try to collect more information and make sure we're moving in the right direction. But I'm concerned that if we truly have a crisis, which demonstrates a need for us to pass legislation to help fix the crisis, and we don't have any consistency around the data that's being presented, how can we move forward with passing a bill that is really, in essence, a solution in search of a problem? We haven't been presented with concrete evidence around the number of individuals who would be affected by this bill. The numbers range from 2,000 to 10,000, plus the post-secondary population, which could be anywhere from 4,000 to 7,000 students. So I have a lot of concerns about creating a group of minorities by discriminating against kids and adults that are unvaccinated. Kids like Colin Aponte, who last year was the first student in the state of Maine to win the Maine Spelling Bee and the Maine Geography Bee. A kid who was celebrated by this body as an outstanding student, and now will be an outcast and a pariah if we pass this bill. I have concerns about creating a group of minorities who will be discriminated by this bill. What about the unvaccinated parents that go into the school system? I mean, we're not passing any legislation here that requires everybody in the state of Maine to get vaccinated. So how is this really going to help solve our problem? And finally, we heard from testimony here that herd immunity really exists between 92 and 95%. That was testimony of a supporter of this legislation, Lisa Tappert, who stated herd immunity is the protection conferred on a community by a level of community vaccination of 92 to 95%. She went on to say, when asked if we were all set because the vax rates in Maine were around 95%, that we are all set at this time. Honestly, we don't even have continuity from CDC about what our vaccination rates are. I can't in good conscience support legislation that doesn't even have with it the assurance that it will solve the problem that we believe exists in the state.
Representative Rudnicki had her hand up.
Thank you, Madam Chair. Before we get too far into making our own statements or whatever, I would certainly appreciate some information from our health professionals that are going to be affected if this goes through in our hospitals because of the number that's impacted and our, again, we'll go back to workforce. So I don't know if we have anybody that can speak to that and to how that's going to be affected in this, because is a significant number that would definitely be affected for that. So I don't know if we want to go down this and to talk about that, because that is certainly part of the bill as well.
Representative, do you have a specific question that you'd like to ask before I find out if there's anyone here who can answer it?
Well, my specific question would be, do they have a plan to basically lay off all of these unvaccinated people from our medical centers and our hospitals? Is that the plan if this bill goes through? Are they going to be forced to get vaccinated or whatever, or are they going to lose their jobs? And if that's the case, are we going to go down the road of having even more medical professionals that we are losing in this state?